All right, let's start here. The deaf community says it faces unique challenges, including neglected mental health and access to care. The community says it is often overlooked and marginalized, living members grappling with a host of emotional, psychological and societal issues that significantly impact their well-being. According to the World Health Organization, over 1.5 billion people, nearly 20% of the global population, live with hearing loss, whilst 430 million of them experience disabling hearing loss. Researchers project that by 2050, the number of individuals with disabling hearing loss could surge to over 700 million. Within South Africa, a staggering 12 million people contend with some form of hearing loss, which has a devastating impact on the individual, manifesting in academic difficulties, heightened unemployment rates, poorer general health and social isolation. The deaf community says it is not immune to mental health challenges, with depression, anxiety and substance abuse being common adversaries. Activists say one of the most prominent obstacles facing the deaf community is communication. In addition to the communication barrier, stigma remains a harsh reality for many deaf individuals. All right, well, Dr. Ian Westmore is a board member of the South African Society of Psychiatrists, and he joins us to explore more on mental health amongst the deaf community. It's always a pleasure to see you. Thank you very much for being with us this evening.
It's a pleasure to talk to you. Thank you for having me.
You're most welcome. Let's talk about some of the contributing factors, and I think some of them were, in fact, highlighted there, which caused the little to no recognition of mental illness amongst the deaf community. One was interesting to me, and it goes back to a conversation you and I actually had, I think, last week, about the lack of access, which is, being spoken about again, a lack of access to care being highlighted as one of the, main contributing factors. And I think the example I made to you last week was, I think it was about domestic violence and GBV, that some of these people in some of these communities simply don't have access to help. And here we are again talking about this issue of access.
Yeah, access is a huge problem, and not just in terms of mental health. And I think that for the deaf community, it is a huge problem because it's a question of communication. Yeah. And being able to just have basic communication can be very difficult for someone that is hearing impaired. Yeah. And then actually translating that into making known what your emotional condition is a significant challenge. Yeah. So the problem is that most health professionals are not proficient in something like sign language, and therefore eliciting the correct symptoms and signs, for instance, in terms of psychiatric disorders, is especially difficult for them, and that's why it's often missed. And deaf people often go unrecognized because of that, because of this significant communication barrier. Yeah. Deaf people face almost sort of like a double stigma. On the one hand, it's the stigma of being deaf or hearing impaired. And then on the other hand, if they have mental health conditions, we know that there is always the problem of access to, or people actually coming forward to get help for their mental health conditions. So it's doubly more difficult because of the double stigma for people that are hearing impaired.
Yeah, I'm trying not to be offensive in the question I want to ask you next, but it is always seen as, rather offensive to make, certain assumptions about, people that are deaf when it comes to their state or, their mental health. To make, even if it was sort of recognized, it was seen as, offensive to sort of point out that someone who's deaf may be suffering from some form of mental illness. I mean, how do you balance, the two when it comes to obviously not wanting to attach any form of stigma to people who are deaf, even though there is this perhaps recognition that someone may indeed be mentally ill as well as being deaf?
Yeah, yeah. I think that is a problem with any disability, for instance. I think it's especially a problem in people that are profoundly deaf, or perhaps that are born deaf, that they have to contend with this stigma right from the outset in their lives. But we must remember that hearing impairment is over a spectrum. You can have people that have mild to moderate hearing loss, such as we often see in people that are getting older, particularly men, where their hearing gradually goes down, and that can be quite disabling. So whereas they were previously able to function normally, suddenly now they find themselves being socially isolated. They can't be part of conversations anymore. And we know that's a significant risk in terms of mental health, because people that have hearing impairment are, if you look at depression and anxiety, are 4 times more likely to develop depression and anxiety compared to the general population. And those with hearing loss in the older years are at a significant risk of developing dementia as well. So there's a correlation. One study showed that if you have moderate hearing impairment, that your chances are 1.4 times higher. And if you have severe hearing impairment, it's 1.6 times higher. And because of the stigma associated with it, we often find that people, for instance, don't want to wear hearing aids because they think that they're going to be considered to be impaired or dumb or something like that. So they don't get their hearing aids, and then they are even at higher risk of developing dementia or these neurocognitive impairments and depression as a result of that. So it's not just those that are profoundly deaf, it's those that have mild to moderate or moderately severe hearing impairment as well that are also especially at risk.
Yeah. Dr. Westmore, obviously, I suppose you would have heard the news, of course, that, recently in South Africa, sign language has now been put as has been added as one of our official languages. Do you believe that this might change, I think, what you refer to as the sort of a barrier? I mean, if there aren't people in the, in your industry, for example, psychiatrists who indeed know sign language, I mean, I guess that won't help really. But this is a step, in the right direction, though, isn't it?
I think it is a step in the right direction. But the problem also for us, for instance, is that if you're working even with an interpreter that can use sign language, that interpreter might not be conveying precisely what the patient is feeling.
Yeah.
And often we're dealing with very personal issues and things such as emotions and so on. So the interpreter who is doing the sign language for you could inadvertently be introducing a further barrier to them. And that makes hearing impaired people ultimately feeling very uncomfortable and even misunderstood. So we have to look at other ways of diagnosing these conditions, such as, for instance, using a checklist that they can fill in or write down responses to questions, because we have very specific things that we look for in conditions such as depression and anxiety. And then, for instance, asking someone something about substance use, because there's a high risk for substance use in hearing impaired individuals. As they socially isolate, they turn to substances for relief. And now trying to work that out through an interpreter can be quite difficult. So it's really as if you're working through several barriers trying to get to the correct diagnosis and treatment. But certainly it will help if medical professionals and others that work with hearing impaired people can at least learn basic sign language, which most of us can't do, unfortunately.
Yeah. Out of interest, Doctor, I don't know, would there be some kind of an idea in terms of what the suicide rates? You're talking about depression, which is obviously worrisome, and then one then has to automatically think about the rates of suicide amongst those people who are deaf. Do we have any idea in terms of what that's looking like? Are you hearing some cases of people in the deaf community that are indeed suicidal and in fact do commit suicide?
Yeah, we unfortunately don't have any statistics regarding that, but one would assume that that's a significant risk. For instance, we know that in South Africa, and we spoke about that last year, we have one of the highest suicide rates compared to other countries in the world, particularly among men in South Africa. And we know that depression is one of the major contributory factors to the risk for suicide. So if hearing impaired individuals are at higher risk of developing depression, then one has to automatically assume that they are going to be at very high risk for suicide. And then if you have something added in, and we know that these are compounding factors, something like alcohol abuse, which is the deaf community is at risk of doing that as well because of the social isolation, that increases the suicide risk as well. So globally, about 10% of patients with depression eventually do die by suicide. And this would be a compounding factor. So I can't give you precise factors, but one can assume that this would be a very significant risk, also because of the social isolation that hearing impaired people experience.
Dr. Ian, it's always great to have you on our show. We appreciate your time and your input. Dr. Ian Westmore is a board member of the South African Society of Psychiatrists.